deep tissue is you're always going to start with a warm-up. Okay, you cannot go into deeper work without warming up your superficial tissues first. So however you do that is up to you. Okay, I mean, go back to your Swedish protocols and use those, or however you normally start. But you never just go in and start with a deep tissue. Okay, always warm up. I'm going to do kind of a quick warm-up here. And I won't go real deep on you, Dexter, so that because you're not going to get a thorough warm up, but just for the purposes of the demo. Okay. So this is for our extensor muscles of the back. Okay. So remember, we have 4 sets, 4 groups of extensor muscles. Okay, from superficial to deep. We have the Spinotransverse group. Which 2 muscles are in the Spinotransverse group?
Splenius, Capitis, and Splenius, Cervicis.
Okay. Then our next group is the Erector Spinae. What's our 3 muscles in the Erector Spinae? You can use the board.
Iliocostalis, Longissimus, and Spinalis.
Okay, good. Then we have the Transversospinalis group. You have 3 muscles in that. What is it?
Semispinalis, Rotators.
What's the M?
And
Multifidus. Okay. All right. So that's superficial to deep. So remember, deep tissue, always working superficial to deep. Okay. So let's work on the upper thorax and neck first, okay? Because that's where your capitis and your cervicis is. So I'll show you some good techniques here. A couple of you can do from a seated position, then I'll show you also from a standing position, okay? So let's do capitis. From here to here, mastoid process, okay? So I don't want to just come parallel to the spine because these widen out when you get up to the neck, okay? So what I like to do, come in here, okay? Pull the arm towards you and then come to an angle and come right into that. Your mastoid process is right here behind the ear. So as I come up, here's my origins. And then I can turn, bring my arm up against the mastoid process in the occiput. So I'm getting these lateral fibers out here, okay? I can start here, I can come down the side of the neck, and then into the origins and pull across. But I like to then just pull back along that occiput and that mastoid process. You can even do, if you want a little bit more work in there, you can do a little supination and pronation, because the radius will rotate around and it'll get all of those insertions here at the mastoid process along your nuchal line here at the back of the occiput, okay? So I can come and do what you do to one side, you do to the other generally. The exception comes in where if one side's tighter than the other, you got a trigger point or something on one side you don't have on the other side, of course you're gonna spend a little more time on one side than the other. It's not a strict rule the way it is in Swedish, okay? So whenever you feel tension or issues, you stop and you work that muscle until it's, until you work it and then go to the other side. So one side might get more work than the other in this case, okay? Now, I can also do this from a standing position. Coming up with my forearm, since the origins are all on the side of the vertebrae, I want my hand to be parallel, right? Make sure you don't go into the spine. You're just as close to the spine as you possibly can get, okay? I'm going to come up here. I know my origin is on the mastoid process, so when I come up here, I'm going to go up the side, the lateral part of the neck, and just come in, okay? Do a little circular friction.
That's the insertion.
That's the insertion. If I come up here to the back of the neck, I'm missing this lateral. This muscle comes very lateral to the back of the head, okay? And that's where I want my direction to be, okay? Now, cervicus does not come up to the head. It stays on the cervical vertebrae, okay? So what I want to do, remember, cervicus is deep to capitis. So now if I want to get a little bit deeper, just put a little bit more weight into it. Lean in just a little bit more. Remember, you don't have to, a little bit of adjustment in your stance is going to change the pressure a huge amount, okay? So just regulate how much you're leaning in, okay? Now from here, now I kind of want to stay close to the spine, but I don't want to come out laterally. Capitis was out here, cervicus is in here, okay? So what I like to come to, now I can keep my forearm into more towards this lateral neck. Okay, how's the pressure, Dexter, okay? Again, you can see I'm not going all the way up to the head and I'm not coming all the way out here laterally. I'm staying right here where that insertion is, okay? So that's capitis and cervicus, okay? Erector Spinae, unlike the other two, go all the way up and down the spine, starting all the way down here at the sacrum and going all the way up to the skull, okay? Okay? So you can see this strap of muscle right here? That is his Erector Spinae, okay? Spinalis, close to the spine. What's our next one? Longicimus, Iliocostalis, out on the ribs, okay? And I can feel where that ends. He's got nice definition in his muscles, so I can see. That's about how wide his muscles are, that group, okay? So when I want to do this, I have to make sure that as I add in a muscle that I'm going out laterally on the thorax, okay? If I stay close into the spine, then I'm mostly getting spinalis and probably some of the Longicimus, but not as much as Iliocostalis. So this is going to take multiple strokes, 2 or 3, right? Not a lot, I mean, you know, to cover all 3 muscles. So I like to start from here, right? The muscle starts here. And if you start here, you're not going to put your pressure down until you're here. So this lower part doesn't get as much pressure. So do this. Come up the side. I can feel his iliac crest right here. Okay, that's my border. Come up, start leaning in so that you get these lower muscle fibers. Turn, sink in, start to move. Close to the spine. Comes all the way up onto the neck. So come up to the back of the head. And then you can slide off. You can go all the way back down if you want, or if you want to start incorporating some of the shoulder and come down, that's fine too. However, that's personal style, right? Next pass I'm going to do, I'm going to come over laterally just a little bit so I can make sure that I get the rest of Longicimus and start to incorporate some of Iliocostalis. So I come over just a little bit. When I get to the shoulder, into the neck, just come up. Okay. I always like to do a little friction, right? Because our origin, one of these muscles is coming all the way up here to the occiput, to those nuchal lines, right? And down, start over. Now, third pass, come all the way out, and I'll get the rest of Iliocostalis. So I'm even further away, okay? And then go up into the lateral part of the neck. okay? Now, however many times you want to do that depends on the client's tension level, all those, you know, all that kind of stuff. So you tailor it according to what the client needs, okay? Now, you can go from here to here too. You can start here, come down the neck, go down, turn your elbow as it gets down to the sacrum, go into that top of that iliac crest, and then off, okay? Now, again, just do that 3 times, okay? So the other thing you don't want to forget when you're down here, you want to get to the, working on the sacrum. One thing you definitely want to do, I showed you guys the sacroiliac joint, okay? Sacroiliac joint is an important part of doing deep tissue on the back. Remember, that's where the sacrum and the ilium meet. We talked about that the other day, and there's a little groove, okay? So, this is where you combine your work in the lamina groove, going all the way down the lamina groove into that sacroiliac joint, right? So we know all of these little muscles are crossing over from spinous process to transverse process. They're all crossing over that lamina groove, okay? So you can use your thumbs. I'll also show you as you get a little bit more confident, you can use your elbow as well, okay? But when I want to get into the lamina groove, I just kind of guide my thumbs over. Make sure you support your thumbs. You never just want to do this. You always support underneath your thumbs, okay? You'll feel his spinous process is right down the center, so you want to be on either side. And what you should see, you can see his spinous process is kind of sticking up. So as I'm coming down the lamina groove, I'm working all those little Erector Spinae and Transversospinalis, all crossing over each one of those little joints. As soon as I get down to the end, I'm going to feel 2 little grooves on either side where the iliac crest meets the sacrum. And there's a little groove there and a little groove here. Get your thumbs in there, do a little friction, okay? That's a really important joint to work. You can't do low back work without addressing that sacroiliac, okay? Now, as you get more experience, feel free to use your elbow, and I'll show you a little trick on how to use your elbow without controlling it better and not going over into the spine, okay? Because this is a kind of a rounded strap of muscle. So when your elbow's on there, it might feel like you're going to go back and forth, and you don't want that elbow to go into that spine. So take your outside hand, cup it around your elbow, okay? As you do your stroke up and down, your fingers are going to be in front, and they will be able to feel the spinous process. So as long as my fingers are over here, I know that my elbow is not in that spine, okay? And it'll keep you straight instead of being here and then accidentally going like this, right? This will keep you on track, and you'll feel the spine at the same time. And then flatten out and come off, okay? So just use this as a guide, okay? Use that as a guide. It gives your hand something else, your other hand something else to do too. Eventually, you won't need this. You'll feel much more confident. You'll have much more control. Now, you can stick, if you have a narrow enough elbow, you can stick your elbow in the sacroiliac joint, depending on how wide somebody's is. I stick my elbow in people's sacroiliac joints. But again, use your other hand to feel ahead of your elbow. Okay? Take some practice. When you first start this, don't go in there with all your strength. Just slow down and feel your way. Again, close your eyes and just let yourself feel what you're doing. Doing that, put a little bit more weight, and I'm getting Semispinalis, Multifidus, Rotators. Those are the ones that also are real small. Working the lamina groove will work the Transversospinalis group. Okay? Now, Suboccipitals real easy group to do because they're only located up here at the top, the very top. Remember we said our origins were all C1, C2, right? All the origins are up here, all the insertions C1 and the occiput, okay? So I can do a lot of work here. I love doing the suboccipitals. I can do it from a sitting position. What I like to do is come up with my forearm on the lateral part of the neck and just come up, and I mean these are high up under the occiput, so I really do want to put pressure under the occiput. If I'm just kind of surface here, I'm not getting them. I've got to get up underneath of them. So taking my forearm and really just kind of bringing it up under, scooping up underneath the occiput and pulling against the occiput does it again. Put a little supination and pronation and you'll get your radius to help you out as well, okay? I can do a little friction, back and forth, okay? Again, I can alternate if I want, one side at a time. That's a personal style, okay? But make sure your pressure isn't down into the neck. It's got to be up underneath the occiput in order to get those, because they're hidden up under here. These are called the ghost muscles for a couple of reasons. One, they're kind of hidden up under here, and number two is because they're so deep underneath there, people who get like these tension headaches and whatnot in there, they're like a ghost. You can't really tell where the pain is coming from. It kind of feels like it's all over. Usually that's up in here in the suboccipitals, okay? So I do encourage you to really use your forearm a lot in this area. This is a perfect space to use your forearm in. You can also pull against the occiput and push your arm away and really stretch out. Look, I'm stretching everything here, right? Capitis, cervicis, the top of traps, right? Pull this way, and I'm pulling against the suboccipitals, okay? Your secret here is these get deeper and deeper. So every time you do something, you just get a little firmer, a little more body weight or a deeper tool, okay? You don't start going to the suboccipitals, you build up to that, okay? Which means you're slowing down. Deep tissue is slower so that you give time for your body weight to penetrate the deeper muscles, okay? If you lean into a client with a lot of weight, but you're going at like 90 miles an hour, you're not giving yourself time for the weight to sink in. So you think you're doing deep tissue, but you're going so fast, those deeper muscles haven't felt any of that pressure, So if this is your normal speed for a Swedish, let's say, okay? Good. Not too fast, not too slow, okay? This is a moderate speed for a Swedish. This is going to be your speed for a deep tissue. I'm moving. But I'm giving myself time. The muscles in his back, the deeper muscles in his back, are starting to feel the pressure. If I just did this, you're not coming in contact with those deeper muscles long enough for them to feel that pressure. So all your deep tissue strokes are this slow. Okay? To be effective, they have to be this slow. This is why deep tissue takes longer. This is why you could spend 60 minutes on a client's back and all you're doing is his back. Right? That's not a problem at all. That's not hard to do because look how slow your strokes are. Okay? And if you're doing multiple passes, okay? Multiple passes as well. Okay? Questions?